Good evening, everyone. We're going to get started in just one moment. I'm just waiting for a few other people to hop on, and then we'll get started in just a second. All right, with it being 6:02, we're just going to go ahead and get started. Let me go ahead and kick this off. All right. Good evening, everyone. My name is Satori Gibson. I have the pleasure of being your Philadelphia Medical Reserve Corps coordinator. And tonight I'm joined by one of my former colleagues, but also someone who's been heavily integrated and involved with the Medical Reserve Corps. Her name is Sydney Bennett, and she was actually our clinical coordinator for a while for MRC, and she's still heavily involved in the MRC, and she's going to give us the clinical rundown of pretty much what you can expect when you're deploying to support special event deployments like this. So I'm going to go ahead and just share my screen, and then at some point I'll hand it over to Sydney, and she'll get on with her portion of the training and presentation. Right. And if at any point anybody can't hear me, or if you have any like technical difficulties or issues, please let me know. Sometimes this can be a little bit wonky. We try to work out the quirks, but if there are any, just let us know. We'll fix it for you. Let's see. Okay. All right, so we're gonna go ahead and get started. As I mentioned, my name is Satori Gibson. I've been your coordinator now for the past going on 5 years. So I'm very happy to be here with you all this evening and to also be your coordinator for the MRC unit. And then, like I mentioned, join on this call with me is Sydney Bennett. She actually just got married a year ago, so I have to update that slide. So she was formerly Walker, now Bennett, and we'll just go ahead and kind of jump right in. If you have any questions, please feel free to enter them into the chat. I'll be monitoring the chat towards the end, and then we'll do a quick Q&A to answer any questions, lingering thought that people may have. And if you don't feel comfortable either entering the questions in the chat, you can always email us. I'll put the contact information at the end. That way you can email us directly and get your questions answered that way as well. Okay. So for the agenda tonight is as follows. We'll start off with just some brief MRC history, useful information, things that you will absolutely, or you should know about our unit, or if you didn't already know, and something that you may find interesting, a little bit about our history and how we kind of got our start here in Philadelphia. I'll talk about some MRC partnerships and some key stakeholders that we have a great rapport with that help us do the work that we do. We'll talk about some training and deployment preparations and the things that kind of go into that. And then, for the purpose that you all came here this evening, we'll get into what it's like to be at a special deployment or a special event deployment, specifically a sports medicine event like like this one, or like the marathons that'll be coming up next weekend. So we'll really give you an in-depth look as to what you can kind of expect when you're deploying to support one of these events. All right, and then we'll talk about some eligibility criteria, followed by like the volunteer deployment process and any other useful information pertinent to that. I'll share with you some interesting and not interesting, but useful point of contacts for your MRC deployments and activities. And then, as I mentioned, we'll get into some quick Q&A, and then I'll kind of just hand it over to Sydney to kind of kick it off and start her portion of the presentation. So for everyone's awareness, just, so you can get a sense of where the MRC came from, who we are, and what we do. MRC is a short acronym for Medical Reserve Corps. It is one of 800 community-based units throughout the nation. The first MRC unit was actually started in 2002 following the attack on the Twin Towers on September 11th in 2001. The Philadelphia MRC got our start here, which is crazy. It'll be almost 20 years in 2005, where there was a massive, realization that we really needed this massive workforce to mobilize and respond if need be for any emergent disasters or any type of response deployments or large-scale special events that are happening and occurring in Philadelphia. Everyone's pretty much familiar with COVID-19 at this point. Don't have to harp too much on that, but just to recap, that was one of our biggest deployments to date. We deployed very effectively and for quite some time. It was about a 4-year deployment where we were actively sending volunteers out into the field to respond to different aspects that addressed COVID-19, whether it was vaccination services or clinics that we ran, or just community canvassing, disseminating important public health information about that. Volunteers were heavily involved for the COVID-19 pandemic response. Another large response that we've actually completed in the past was in 2021. We were involved with the Operation Allies Welcome response, which, if you aren't familiar with that, that was the time and period where a little over 27,000 Afghan refugees came through Philadelphia's international airport to seek asylum, and we were kind of we were there to provide logistical support, whether that was line staff, translation and interpretation services. We also obviously handled a clinical component as well by providing different types of screenings, triage, and vaccination services as well. So just wanted to kind of give you an overview or brief overview of some of the history behind our unit and, where we got our start from. I mentioned that I was going to talk about some key stakeholders and partnerships. So we have long-lasting connections to these 3 organizations right here. Office of Emergency Management manages any and all, local disasters that may affect Philadelphia or Philadelphians. And they also partner with us to transport some of our logistics and supplies to and from some of these emergency deployment sites or response sites. We also have a very healthy and robust relationship with the Philadelphia Fire Department. We partner with them and support them in 4 of their annual special event deployments that I'll actually get into in just a minute, in another slide or 2. But we support them in their EMS and medical tents, and I'll talk a little bit about that later on. And then lastly, we partner with the Philadelphia Police Department. Every year we do an inoculation exercise, essentially for flu. So it's a rapid mobilization and deployment of our volunteers to see how quickly and effectively we can inoculate first responders and their families. This is an exercise to test and see what our core capabilities and abilities are if we needed to do this in a real world emergency. If we needed to set up, any type of clinic to where we needed to mobilize and deploy our MRC volunteers to rapidly inoculate first responders so that they can go out and address whatever emergent situation has occurred. So that's just one of our many exercises that we do every year. So talking about some of the annual large-scale special event deployments that we work and staff every year. If you have been a part of our unit for the past couple of years, then you'll know up until this past year, actually, I believe maybe it's been 2 years now, we used to do Made in America Music Festival, and that was a big 2-day event that happened on the Parkway. We were there with the EMS and fire personnel, and we staffed the medical tents. basically to treat and triage any clients or patients who came in with any illnesses or injuries. And that model stays true for all these events that I'm going to list, including the first responder flu clinics, where I actually just mentioned that we partner with the police department for that event. And volunteers are there to assist with data collection, vaccine assembly, with administering the vaccinations themselves. We try to heavily integrate as many MRC volunteers into our exercises and training responses as much as we possibly can, because again, in a real world situation or emergency, you guys would be the folks that we would tap on for that extra volunteer and staffing support. The Broad Street Run is another event that we partner with the Philadelphia Fire Department to support. We, again, are in their EMS medical tents. That's a one-day event that we treat runners and those who experience some injuries and, maybe some illness that comes from participating in that sports medicine event, which again, Sydney will touch a little bit more heavily on the clinical side of things when we get later on into her portion of the training. The Philadelphia Half and Full Marathon is a great segue / plug for me right now, because we actually have that coming up next weekend, which is the whole reason we're actually doing this training. I tried to provide this special event deployment training before any of our large scale event deployments, like the marathon or the Broad Street Run or Welcome America, or anything else that we may partner with the fire department to staff. And so the reason that we do this is not only to facilitate and strengthen our rapport and our relationship with the fire department, but if you think about it, there are thousands. I mean, there's over 1.5, I think at this point, 1.8 million people that reside in the city of Philadelphia. We are a large city, which means for events such as this, we have thousands and thousands of people coming out to either attend or support a loved one or friends who are attending or, participating in this type of event. For the marathon, it is a 2-day event. And I'll get into a little bit more about exactly what that'll look like, and I believe in the next slide or two. But we are inside a heated medical tent. They do try to accommodate us as much as they possibly can. And we basically treat and triage runners who come in with any illnesses or injuries that they may have sustained during the marathons. And again, we'll dive a little bit deeper into that later on. And then I mentioned the Welcome America Festival, which is held annually every year on the Parkway. A lot of our events, if you haven't picked up on the trend, they're held on the Parkway. That's just where Philly, we host a lot of our large scale events at spatial, purposes and logistical purposes. That is the best and most ideal area that the city can effectively plan and execute events. I'll kind of just run through this pretty briefly because all of you should be familiar with this, if you volunteered at one point or the other. But for those of you who aren't familiar with this, or maybe are new to our unit, or would just like a little behind the scenes, look into what I do and what it takes for us to prep and prepare for these events. So first things first, you all had done this because you're in the MRC unit and you're also on this training this evening, but you have to register to become a volunteer. I mentioned this just in case you have anyone else who's interested in volunteering with you. We're open to any and all parties as long as you are 18 years of age or older. You are welcome to become an MRC volunteer. If you have friends or family or fellow students, maybe you're undergrad or graduate student or med student. If you have students who are, interested in volunteering, maybe you're an instructor and you have students who report to you. Anyone can really get involved with the Medical Reserve Corps. You don't have to be a medical volunteer or clinician per se to be involved. Once you register, because that's the only way you can, get in our system and then be deployed, you'll be able to sign up for deployments. You'll receive what we call Survey Monkeys, or we put together these very comprehensive surveys to send out to you all, basically to give you an idea of what upcoming events and opportunities we have for you. And, based off of your interests / availability, you can select which ones you would like to participate in. Certain deployments, like the marathon, for instance, we receive requests specifically from either the fire department or other external partners or stakeholders, and they request specifically what they would like in terms of staffing support. What does that mean? That means, for instance, for the marathon and for something that would require a little bit of more clinical insight and knowledge, they do request that we heavily provide them with clinicians and experienced clinical volunteers. And just for everyone's clarification and, for your own knowledge, a clinical volunteer is someone who has an active license, who is able to actively practice clinical care in the state of Pennsylvania. You have to be licensed in Pennsylvania in order to be considered a clinical volunteer. Meaning, if you're licensed over in Jersey, but you don't have a PA license, we appreciate that you have a clinical background. You may still be deployed to support certain events. However, to do any of the clinical on hands work that may, or hands-on work that may be required in the field, you do have to have an active license to practice in the state of Pennsylvania. And if you have any questions about that, please feel free to reach out and let us know. We'll be able to answer any questions that you have. Once you sign up for any deployments that interest you, we'll send you what we call a deployment summary. This is your official notification letting you know, hey, you have been selected for this deployment. I'll typically put in the email, like, if you don't hear from us within 24 hours, then you were not selected for this particular event, or, guaranteeing, like, if you sign up for this thing, you will receive notification from us within this allotted, amount of time. And I do that for the purposes of, I have my own deadlines to meet in terms of staffing, and I need to make sure, that I have an adequate support number of volunteers to deploy for these type of deployments and to these sites. So I try to, put as much information in those deployment summaries and, communicate that to you via email as much as I possibly can. And then I'll reiterate any updates or any pertinent and relevant information for that deployment. And so signing waivers, every volunteer, regardless of whether it's like a clinical or non-clinical deployment, anything you do with us, any event, any training, any activity with our MRC unit, you are required to sign a volunteer waiver. This is the confidentiality and liability waiver. Essentially, and we go over this in greater depth in person as well, or specifically if anybody has any questions, I'm happy to answer them. But essentially, the confidentiality waiver just states if you're ever deployed out into the field, for instance, at the marathon, you're going to be exposed to sensitive information, patient, confidential information. It's just stating that you're not going to take a photo and post it on your, your social media, or break HIPAA in any way. You're going to keep the details about your deployment confidential, about whatever patients you're dealing with confidential. If you receive a deployment summary with a specific date, time, location for certain deployments, that is specifically for you. That is not for you to then share with 10 other people. If you have any questions about that, or like saying, hey, like, I have another person that I know volunteers that is also interested in the same deployment as me, is it possible that we can be deployed together? Feel free to reach out to us, directly, and we're happy to work with you to make the deployment work for the both of you, or for whoever wants to get involved. If we can make it work, we're more than willing to do so. If not, we'll make the best accommodations that we're able to do so, for that specific deployment or situation. On-site training, we call this JITS, or just-in-time training, which Sydney will go over during her presentation. And that's just basically reiterating your expectations for the day, the roles and the responsibilities that you'll be tasked and assigned with. It'll outline your scope of practice, which, again, if you're a clinical volunteer, you'll be given a specific scope of practice of things that you're able to do and things you're not able to do. My clinicians, you're not going to be performing an appendectomy on the side of the road. You're just not. I'm sorry. At most, you'll be assisting another clinical volunteer, or someone who's an EMS professional or works with the fire department. You'll be basically those second hands, assisting them with whatever clinical care they need to perform. We don't do anything clinically invasive. And again, Sydney will go over that a little bit greater in depth in her portion of the training. On-site point of contact, or POC, ideally 9 times out of 10 will be myself or another counterpart. We will always send some representative from the health department in the field to be your eyes and ears, to be your support, to be that liaison. We're never just going to send you out into the world on your own to fend for yourself. There will always be some form of either MRC or Philadelphia Department of Public Health representative or representation on site the day of your deployment. If you have any questions about anything I've said or anything, pertaining to your deployment, please contact us. You can always feel free to email us at mrc@phil.gov, and I'll list some additional contacts or point of contacts at the end of this training. For arrival time, meeting location, and check-in, this is very important. I stress this every year for every event we do. Specifically for these special events, arriving on time at your meeting location is essential. I try to outline and give you as much information as provided to me and then some. For instance, for the marathon, which I think there's an example in the next slide that I'll go over. I send you maps, I mark the maps, I will be as detailed as I possibly can be with icons, and I will sometimes draw, circle locations of exactly where you need to be. I will send you, the Google Maps link of where you need to meet us at. But it's very important that you follow the information outlined in your deployment summary with the arrival time, the meeting location, the check-in. If you have any questions about that, please feel free to reach out to either myself or whoever is listed as your MRC point of contact for that specific deployment. And this is important because you need to know these things in order to not only show up on time, but for these special large-scale events, we're showing up as a unit. We're showing up together. I'm never going to leave someone hanging or stranded somewhere. So for instance, for this marathon, which I think I'll get into, in this next slide, this is just a sample of something I typically send out to the volunteers who are selected for that deployment, just outlining essentially like where things are retrospectively, thinking about, okay, well, if we're supposed to be in this medical tent, where would be the best place to meet up with volunteers at? So I really take all of these things into consideration when sending these deployment summaries out to you all. For the Philadelphia half and full marathons that are coming up next weekend, our meeting location, and actually for pretty much all the special events that I've listed during this training this evening, our meeting location is typically at the 22nd and Winter Street Bridge. That's right off the Parkway. I will send you a map with a pinpointed location of exactly where to meet. We do our best, and I definitely, fight tooth and nail for you all so I can, get you not only secured parking, but free parking as well. You guys are coming out, volunteering and dedicating your time and your services to help support us and to support the city. It is only fair that we in turn return that support and provide you with as much information as we can and with as much accommodation as we can, to make this as easy and transparent as we can for you. So I will send out another update for those who are selected for the marathon. You should have already received your deployment summary from me. If not, if you're still wondering whether or not you were, please feel free to reach out and email me. Definite and deadline decisions are to be made by Friday. I will make sure I send out all the updates leading up to the day of the deployment. As I get this information, I'm sending it out to you guys. So anything I get, you get. So I want to make sure that everyone's, we're being fully transparent and so you have everything that you need to make your deployment, go as seamless and as smooth as possible. So again, and I'll mention this in the updated email that I'll send out to those who are selected for this deployment for the marathon. Both days, if you were selected to deploy to that, whether you are walking, biking, taking public transit, and or driving, we will all meet at the 22nd and Winter Street Bridge. Police have been notified. I've secured parking for everybody who notified me that they needed parking. If you just had like a oh crap moment, I need some parking, let me tell Satori. Please feel free to email me, let me know, and I'll make sure you have the accommodations you need. But we will all be meeting at the 22nd Winter Street Bridge, and I will again send that information out in an updated email tomorrow, in addition to the recording of this training as well. So it's accessible via, again, driving, walking, biking. You'll be good to go. And I will have a city car with me with our city decal and logo on it as well. So I'll be standing by the car. I'll be in MRC logoed apparel, so you'll be able to easily, spot me. And some of my other colleagues as well will be there, to help assist you and to orient you to make sure everybody is where they are supposed to be. When you arrive to any deployment, we will make sure you get signed in. We will make sure you get your waivers. We'll make sure you get your credentials, your badges, whatever you need, you'll get. I also bring MRC apparel to every deployment that I attend to, so that you can have your MRC swag, and that so you're easily identifiable. And I will say, if you already have like an MRC shirt or anything like that, if you have anything MRC branded, please wear it. It is very, very important when we're inside the medical tents. Everyone has uniform t-shirts or some type of uniform worn, so it makes you easily identifiable as an MRC volunteer. If you do not have MRC apparel, I will make sure to bring them for you. So you will not have to worry about that. Okay. I talked about credentials briefly, but they'll be given to you the day of. If you see this photo, everyone has like a badge around their, like a lanyard around their neck. That'll be provided to you. You'll have that on at all times while you're out in the field. And that'll allow you to enter and exit through security checkpoints for the marathon specifically. There is a designated area where staff are expected to enter and exit the premises. So again, that's why meeting up at the same location is essential, because we will all be moving as one unit. So we'll all go through, we'll meet up together, we'll walk over to the security entrance point together. I'll make sure everybody gets through security. They really just check your bag just to make sure there's nothing, no dangerous weapons or anything like that in there. You are permitted to bring food and refreshments with you. Typically, the fire department's great. They feed us, they love us, they appreciate us. But just in case anybody does have any dietary restrictions or anything like that, please make sure you bring your own supplements or any type of like food or snack or water that you'll need to sip on or snack on throughout the day. There is designated locations to eat and drink, obviously not in the clinical areas, but those will be, more outlined for you the day of the deployment once we get on site. Once we get on site, I'll orient everybody as to like, okay, this is where we're going to be, housed at for the deployment. This is where you can kind of like keep your stuff. This is where these types of things will happen. And then we'll kind of just go from there. Typically what we do is we pair a volunteer up with another clinician, or who's an EMS or fire department personnel. Okay. And so we work in teams. That's just kind of how we move through these deployments, and all your roles and responsibilities will be very detailed, outlined for you again the day of the deployment. All right, so for this year, for 2024, the biggest ask I will ask everybody who's deploying to these events, whether it's this one, the next one, doesn't matter. At any point, whenever you are at a large scale special event, whether it's the marathons, the broadsheet run, Wow Welcome America, any special large scale event, you will have to text/check out with me, or whoever's going to be your designated point of contact for that day. For this deployment, it'll be myself. We'll always provide you with the name and telephone number of your MRC point of contact. Specifically for the marathon and special events, there's multiple tents sometimes, but also I could be somewhere dealing with something else while you're dealing with something else, whether it's with a patient or a client, or you're with another, staff member, or whatever the case may be. Please always check in and check out with me. That's my personal number. You can text me. Text is preferred. But if you do need to call me, feel free to call me as well. Please leave a voicemail if you call me and I happen to not, answer the phone. The day of the deployment can be hectic, which is why I like to give everyone my number, so that way you can always text me. I will respond, definitely via text. That's the easiest way for me to respond amidst all the chaos that may be happening that day. Okay, so just wanted to put that out there for everybody. And then with that, I'm going to go ahead and wrap up my portion of this training. I know that we have some questions in the chat, and looks like Sydney answered a few of those. So if you have any other questions about anything I presented on, please feel free to empty those questions into the chat. I'll address those at the very end, but right now I am actually going to go over and hand this over to Sydney. All right, so with further ado, I'm going to toss it over to you, Sydney, and let me know when you're ready to go. I don't think we can hear you.
Oh, yeah, I'm unable to share my video. It's not letting me. No. Well, you all can hear me, correct?
Yes, we can hear you.
Okay. Give me 1 second. Sorry, guys, technical difficulties. I guess I've fallen out of practice with Zoom since COVID has not been. We haven't been forced to stay inside and be on Zoom all the time. Give me 1 second.
And you're a co-host as well, so that might make a little bit of a difference. You should be able to know, but let me know if you're not.
Okay, well, there we go. Got the video. I just am unable to share my screen.
I'll try making you a host and see if that'll fix it.
Please stand by. So sorry.
If it's not pulling up, if you want to email it to me, I can email it to everybody if that's easier. But I can also share my screen as well with the presentation for you.
Okay, yeah, I might need you to do it. It's for some reason it's like coming up with all these exclamation points, and
I'll go ahead.
I'm so sorry.
No worries.
All right. Okay, great.
Okay.
Thank you, Satori. And hello, everyone. My name is Sydney Bennett, but formerly Sydney Walker. It's really nice to see a whole bunch of MRC volunteers that I know, but also joining us are a lot of volunteers I don't know. So I hope to meet you one day, but unfortunately I won't be at the upcoming marathon because I have my own sports related injury. So I can't stand or walk or put any pressure on my foot. So I will miss you guys. Please stay warm. I won't miss the cold, but we can actually get started with the slides. Satori, can I have you go to the next slide for me? All right, so during my portion of this presentation, I'm going to go over quickly the MRC scope of practice. And we're going to talk about common injuries and illnesses that occur at marathon events. The most common ones that we'll also see at festivals, some recommendations for certifications and trainings, and then I'll answer any questions at the end, okay? And so, oh, look at these lovely MRC volunteers. We have a wonderful, huge group of volunteers. And so thank you again for all of the support for people that have been with us for a long time, and then also welcome those who are new to MRC. But just to give a little bit of an idea of what our scope of practice is, I'm not going to read the document usually before we actually, during the JIT, the actual physical document is read. But essentially, MRC volunteers are volunteers, right? So we're not there to work, we're there to support. Typically in one of the med tents, you'll have a lot of people from Philadelphia Fire Department. And then there's also likely going to be like a university that is running the med tent. Usually it's like Penn or some major hospital is running the med tent.
It'll be Rothman this year, Sid.
I'm sorry. Oh, Rothman. Okay. Rothman. Well, then Rothman. So we're going to defer to them to do the actual work, and we will be there to support. And so Satori touched on this briefly, but we're not going to be doing anything invasive. And this applies solely to those with clinical licensure. So we're not going to be doing anything invasive. We're not going to be doing any IV placements, no like intubations. We're not going to be doing any like urinary catheters. We're not going to be doing anything invasive. Those are probably like very extremes. But there are times as an MRC volunteer that during a surge and care, there's like a lot of people that do show up at the tent, and the actual employees that are in there are unable to handle the volume. That's when sometimes myself, wherever the current MRC clinical lead will be, we'll kind of tap you, and we'll typically know your skill level, and we'll give you permission to be able to do more invasive things. But again, that usually just stops at placing an IV. There are some times too where you'll attend an MRC event, like a vaccine clinic. And in that case, of course, you can do IM injections. If there's, some type of anaphylaxis that happens, we have EpiPens, you can give those. But for the most part, it is very limited on what you can do. And it's not an insult to your skill level. We all know that our MRC volunteers are very smart and very capable, but we are functioning under the guise or under the clinical license of Philadelphia's interim health commissioner, which is Dr. Frank Franklin. And so we don't want to have a huge liability. But yes, so that being said, if we are called upon to do a bit more because of a surge, it still remains imperative that you don't exceed your scope of practice that's outlined by your licensure. And if that does happen, you will unfortunately be removed from MRC permanently, but you guys are responsible, wonderful volunteers. I cannot foresee that happening. Okay. But that also goes for like our medical students, nursing students. There are some public health emergencies that do give a small scope where you're able to do certain things. But like, for example, during COVID, nursing students were able to give vaccines. We're not going to be actually asking you guys to do any of that. Only people that will do anything that's medical related or direct medical care will be those with a clinical license. Okay. So before we get started with our day, we always go through a JIT. And during that JIT, or right after the JIT, we will give assignments to people based off of their skill level and their licensure. And we'll make sure that you know exactly what you're supposed to do and where you're supposed to go. Okay, well, we can go on to the next slide, Satori. Thank you. So, well, first things first is we're going to talk about marathons and injuries we typically see there. And so during marathons, because they're outside, we see a lot of injuries or illnesses that occur because of the weather. So we have heat and exercise associated illnesses like dehydration, heat rash, sunburn, cramps, heat exhaustion, and heat stroke. And then there's also minor injuries, cuts, grazes, blisters. There's joint and bone injuries, so sprains, shin splints, fractures, muscle tears and strains, and then occasionally cardiac and respiratory emergencies like asthma exacerbations, cardiac arrest, and a heart attack. This past, was it the Philadelphia Marathon? No, it was Broad Street Run. I can't remember. Sorry, I've done many of these. But we actually did have MRC volunteers step in and give excellent CPR and saved a life. So that could potentially happen. And, we hope that you are up to date on your certifications so you can actually help and step in and do that. We can go to the next slide. And so for the heat and exercise associated illnesses, we're going to go just a little bit more in depth. So heat rash and sunburn, for the most part, these are very minor injuries, but sunburn can sometimes get pretty extreme, can cause sunburn, like bad sunburn can cause the fluid to kind of move away from the body and cause them to become severely dehydrated and go into shock. And so if someone does experience any fainting, low blood pressure, weakness, so we want to make sure that we direct them to the medical tent if they're close by, so they can get medical attention ASAP. Okay. Now the heat rash, we do have a tent usually somewhere on the outside where they can get some topical things to kind of help. But other than the shock, we're going to definitely direct towards our main medical tent. Go to the next slide. So there's dehydration. We do see a lot of injuries related to dehydration, like heat cramps. We see a lot of fluid imbalances, and so those people will likely be directed again to our main medical tent. And so for someone, heat cramps are, I think, the most common injury or heat-related injury that we see, or exercise-related injury that we see. It's characterized by heavy sweating during intense exercise and muscle pain or spasms that tend to be pretty extreme. And so if you realize that someone is experiencing a pretty intense cramp, we want to make sure that they're stopping that activity and move to a cool place. We want to give them some hydration, so some water or sports drinks. We usually have Gatorade or soup, like really, really salty soup on the side to hand them. And we want to make sure that those cramps go away. PFD typically, or the fire department typically does not progress these folks into the tent unless the cramps continue. But one of the main things that people can do to help is, well, I guess like you just sit them down, but often PFD will bring them over to a bed and will just elevate their feet. It helps with other symptoms that they're likely experiencing at the time too. But you want to make sure that if you encounter someone outside, that you ask them certain questions, like if they have any heart problems, if they're on any like low sodium diets, before, to try to help the fire department understand what they need to do once that person gets into the tent. Okay. So we can keep going. And then there's heat exhaustion. We see a little bit of that, but I actually would like to go to the next slide for heat stroke. So heat stroke, we have seen primarily in the warmer months, but it is still possible in the colder months. And this happens when someone's body temperature reaches like 103 degrees or higher. And so in the med tent, we'll typically, sorry, my dog is over here bothering me, but the fire department will typically get a rectal temp from these people. Again, we're not doing that. That's something that we consider invasive. We're going to let them do that. But you are more than welcome to help put them in the ice bath. And so these people will typically look hot, red, or have like some dry or like damp skin, fast, strong pulses, headaches, dizziness, nausea, confusion, or loss of consciousness. And so if you do notice that someone does have these symptoms, you want to make sure that you move them to a colder place. That's likely going to be the med tent. You want to make sure that person's body temperature is cooled by any means necessary. So you're going to follow the lead of the fire department to get them that care. And you don't really want to give anyone anything to drink at this point, especially if they're confused or kind of in and out of consciousness, because that can cause other complications to happen. So again, we're going to follow the lead of EMS and then available medical team, and we're going to direct the people to the appropriate treatment area. All right. So some of the minor injuries we typically see. I just want to make sure, does anyone have any questions? Yes, Marlon. Marlon asked if we do rectal temps. Yes, they really do rectal temps in the tent when there is a suspicion of heat stroke. And someone asked, how do you handle disagreement with PFD? Well, so yes, PFD can get a little testy when it comes to us touching their materials. And so I just would advise everyone to just not touch anything unless directed. or unless asked. And then PFD, I don't know if there's anyone on the call, but I kind of equate them to, they're nice people, don't get me wrong, but we just want to make sure that we are as respectful as possible and just follow their lead. I apologize if they are mean sometimes, but I don't think they mean it. They just, sometimes people just don't know how to talk to other people. But I digress. For the minor injuries, we typically have a little box on the outside of the tent to address these. So you want to make sure that you're performing hand hygiene. We have some like saline rinse where we can just remove some of the dirt. We don't want to use peroxide or anything that's going to cause discomfort to the area. And we want to stop the bleeding by applying firm or direct pressure. And we want to cover the wound with a sterile gauze or bandage. And then maybe apply some like antibiotic ointment if available. And these are things that as MRC volunteers, we will likely use. We'll likely be on the outside of the tent helping with these minor injuries. So we can go to the next slide. There's also blisters. Typically at these events, there is a podiatry team that's on site, and we'll probably direct them over to the podiatry team. Sometimes we do place an MRC or volunteer or two with them so they can kind of assist, but it is usually a very small team, but they do love looking at the feet. If you are placed with them, you can make sure, again, wash your hands, apply, cover the gauze with some bandage, or cover the area with some gauze or bandage. You want to make sure that the patient doesn't pop or break or peel off the skin, the damaged skin, because that can lead to infection. And then if available, you might, again, want to refer that person to the podiatry team. Okay, we can go to the next slide. And so a lot of the musculoskeletal injuries people will have or come to you with that might not necessitate being in the medical tent, we can still let them know that when they get home, they should do some kind of RICE. So that's rest, ice, compress, and elevate. A lot of these athletes, some people do come to these marathons without training sufficiently and will have some type of musculoskeletal injury that results from the race. So RICE is definitely an excellent option for people if the injury is not too severe. Okay. I think there was maybe a slide before that, Satori. Yes. So another thing that we see a lot are shin splints. And it's typically because of it's associated with like running or overuse. And so some of those signs and symptoms tend to be pain along the inner edge of the tibia. And then again, that treatment is rest and ice, and you want to do some stretching. And so you want to make sure that the patient is not experiencing like pain that's worsening, or the area of the pain is increasing. If that is, we want to make sure that they really do get some medical attention, and Rothman will be there. And so they're the people that they should probably see. Okay. You can go to the next slide. Slide before that. So there's some things that might fall outside of the MRC scope of practice. So like sprains, fractures, strains, or muscle tears. We want to make sure that we, again, direct them to the ortho docs that will be there. And then it is, again, appropriate for MRC volunteers to escort those individuals, help them, especially if they're limping and need a little bit of a hand. Okay. And so before we move on to cardiac and respiratory emergencies, I do see someone asked about malpractice insurance or liability coverage for clinicians. So as a volunteer, if you're going to be on the street, it's not required, but I would recommend having your own like malpractice insurance for the just in case. MRC, again, does function under the guise of Dr. Frank Franklin. But I think just for your own liability, it is to have your own. Again, we are probably not going to put you in much of a position where you're going to need it. Again, we're just supporting, we're not really working. But if you would like to have that malpractice insurance on you, I think it's a safe bet. It's a good idea. Okay. So were we on to, okay, respiratory emergencies. We do see a lot of people with asthma exacerbations, especially when we're at these festivals. When we're at the Made in America, for example, there's a lot of people, there's usually fire, some type of pyrotechnics there, and it causes lots of wheezing, coughing, chest tightness in those with a history of asthma, or those who are just kind of caught up in the crowd and they're getting squeezed. So those signs and symptoms of an asthma exacerbation look like wheezing, coughing, chest tightness. It's so difficult that they're unable to speak, or they're breathless. They tend to be tachypnic, tachycardic. They might be drowsy, confused, exhausted, or dizzy. They could have some pallor, so like blue lips or fingers, and they could have fainted. So if you do notice that, we again want to make sure that we direct them immediately to the medical tent. And it's important for a PFD to hear that this person has a history of asthma. So I would ask them, because if they do, they don't play around, they let them right in and they get to work. Okay. We can go to the next slide. And I kind of just, so if you notice that someone might be having a medical respiratory emergency, again, notify EMS immediately. You want to make sure that person is sitting upright. And then you want to try and keep them calm, because speaking from experience, having an asthma attack can really induce a lot of anxiety, and that can really make things worse. And so you also want to make sure that person has an inhaler on them. And if they do, you want to instruct them to use it and make sure that they're using it correctly. Like the movies tell people to put inhalers directly in their mouth, but if they can provide some space and inhale deeply and hold for 10 seconds at the top and then let go, it's a good way to make sure that that person is getting their emergency inhaler, they're taking it correctly and getting the benefits. And so there are some cardiac emergencies. We can actually skip straight to the sudden cardiac arrest. This is an occurrence that does happen at these marathon events. Again, at the last marathon that MRC was at, we did have a group of MRC volunteers work with PFD to effectively resuscitate someone. And so again, I congratulate those. I can't remember exactly who was on that team. I know Will was, but in the event that does happen, it's really important as MRC volunteers who are in the clinical side of things. So if you're EMS, EMT, nurse, physician, nurse practitioner, we want to make sure that you have an up-to-date BLS certification in the event that you do need to give CPR. Okay. And then, so some festival injuries that we see, I briefly spoke about it. There's the possibility that you might have to use Narcan. There could be a drug overdose or a suspected one. So I put a video here. This is not, we don't have to play it. I just, maybe we can send out some links to these videos, but it's really important that you do review Narcan administration. You might not know if someone is actually experiencing a drug-related or like a opioid-related overdose, but Narcan is still safe to use in those, even if you're not sure. So please review Narcan administration before you attend any of our special events. And typically, I know every single time I'm out in the community, I do carry Narcan, and it's a excellent life-saving tool. We can go to the next slide.
I'll also link, it's linked on our YouTube page, but we just did a Narcan training with the Substance Use and Prevention Program. So if any of you are interested about that, please check out our YouTube. It was just uploaded there.
Thank you, Satori. can head to the next slide. Again, please make sure you're up to date on your adult CPR. There's not really, I mean, there's a potential for small children, but there's not going to be any babies or anything like that. So I think if you're up to date on like adult CPR, I think that would suffice. And if there's, again, EMT, EMS, Rothman, they're around. So we're here this is the absolute just in case. We are the last option for people. I still would like for MRC volunteers to be prepared. Okay. And then stop the bleed. So Tori, we had a stop the bleed training this year.
We
already?
actually just had one on Saturday. So if you've attended that, everyone who attends gets certified. If you have any questions specifically about Stop the Bleed, you can reach out to us. We do have that presentation on hand and can get you that information. But we do provide Stop the Bleed trainings before any of our large scale or special events. So they're always going to be offered to you at least a week or two before the actual deployment takes place. And even if you aren't deploying to these events, learning these skills could help save a life. So I would encourage everybody to at least attend one of our Stop the Bleed trainings. And again, you receive free certification.
Thank you. Yes. So, unfortunately, there's always the possibility that we might need to stop a bleed. And so it's really, really, really important that you guys do attend those trainings or view those videos, because we don't want to miss the opportunity of potentially saving a life. Okay. And so again, when we're out at these festivals, just make sure that when in doubt, always just consult PDPH medical ops lead, MRC volunteer lead, or the on-site medical team. So that's whether it's EMS, Penn Medicine, Rothman. It's best to just make sure that you are using everyone around you as a resource if you don't know. Okay. And I think that is really all I have. Are there any questions? Mary, thank you so much for stopping in.
I think we do have a few questions. I think some of them you've touched on, but if not, I'll just run through them really quickly. Let's see. I think you answered pretty much the clinical questions about rectal temps and things like that. And as City said, if you have any questions while like in that moment, please feel free to like ask us. If it's something you're not sure if like MRC is able to do, you can always feel free to ask me or whoever your point of contact will be. We'll let you know. Excuse me. And then the medical ops lead or whoever the clinical lead is for that medical temp will identify themselves the day of. I always point them out if not. And when they give their just-in-time training or their overview, they'll let you know if you have any questions about anything clinical that you can go to them. And they're usually a doctor or physician, so they'll be able to answer any questions for you. And they're very experienced as well, especially with these types of events. So they'll definitely be able to get you the answers that you need. I know somebody asked about like how to deal with disagreements with PFD or any difficulties there. Historically, we have a great relationship with them. To Sydney's point, they are great people. They just are structured a little bit differently than we are, meaning personality-wise, they're just very blunt. They're very forward. Again, that's why you always have someone from the health department there, some type of PDPH liaison or a buffer will be there to mitigate any issues that may come up. If you feel, that something was said in a way that wasn't appreciated or could have been said or worded a different way, I take any and all feedback. Please let me know because it will be addressed, if not with them directly, with their superiors, and I have no problems doing that. I have a very open rapport and a great relationship with them, so please let me know, and we want to make sure that this experience is great for you and everyone else involved. So please just give live direct feedback. I'm happy to address anything in that moment. Or if you would rather me address it later on, I'm happy to do that as well. Please let me know if anything comes up. In terms of being partnered with someone from the fire department, they'll let you know exactly what your role is. You're never guessing. And as long as you stay within the parameters of the task that you were assigned to do, you will not have any issues. As Sydney mentioned with their supplies, they're very, very meticulous with their supplies. They know exactly where everything is. So I guarantee you, if you let them know, hey, I need this, they'll find it before you can even start looking for it. So please just ask if you need anything, or if you aren't sure about something, just ask and we'll make sure we get you what you need or get you the answers that you're looking for. All right. In terms of insurance malpractice, I'm happy again to send you a copy of the liability and confidentiality waivers. As the medical reserve corps volunteers, you are an arm or an extension of not only the health department, but of the city. When you're out in the field, you're considered to be a city employee, and all this is outlined in your liability and confidentiality waivers. So again, as long as you're doing tasks that are assigned to you by us and you're not going, beyond those, you're covered, you're good. It's only when, let's say, you take on, like, if you're a clinician and you were told not to do anything clinically invasive, but you decided to do, I always use this as an example, an appendectomy on the side of the road, because it's not something you were tasked to do, you could be liable for that. So as long as you're doing the things that we're tasking you and telling you, like, it is okay for you to do these things, yes, we signed off on it, you're good to go. If it's something that we don't sign off and you just decide to be a lone cowboy, you're gonna have to deal with those repercussions on your own. And if you get hurt or injured in the field, we do have policies in place for those as well. And so an incident reform will be filled out. We'll give you, all the instructions on how to bill insurance and bill us for your ER or whatever visit. Just let us know and we'll walk you through that process. Okay. Let's see. I don't think there are any other questions.
There was a question in the beginning from Geraldo.
Oh, yes, thank you.
Yeah.
To answer that, just to clarify, and I briefly touched on this earlier, it is not my call in terms of, like, the credentials that are required for volunteers to participate in these specific deployments. We get these requests specifically from the fire department and other external partners. And so, yes, in years past, we've had a mixture of, like, medical students with medical personnel or professionals. We've also had events where we've had non-clinical professionals and clinical professionals there. It really just depends on what's being requested from, for us by the requesting party, so the fire department. Because, especially with COVID, there was a lull, I guess, in registration for these events. So they weren't as, the volume for participants and for runners and for attendees weren't as high as they are now. Because there's thousands and thousands of people, like, these events are sold out every year. There's more and more people who come out to support them. And every year there's more and more people who need clinical care. And so they did specifically request licensed clinical professionals to be deployed for this specific event. If I could bring everybody, I would. More the merrier, in my opinion. But because they specifically requested clinical volunteers, again, unless you have an active clinical license to practice in Pennsylvania, unfortunately, we were not able to select you for this deployment. There will be other deployments as well that will, that will allow for clinical volunteers to participate in, even for, like, clinical students, medical students as well. Unfortunately for this one, it is clinical only, and I will always try to specify that as much as I can when I send these surveys out to you guys. So if you signed up for something and you didn't hear back, or specifically about this, this marathon, if you signed up and you didn't hear back from me, and you are not a clinician or a licensed clinical professional, that is why. If you are a licensed clinical professional and you have not heard back from me and you signed up for the marathons, please either text me, call me, email me, let me know so I can circle back and make sure we get you on the schedule for that day, because we definitely will need your help. I'm bringing about 50 volunteers with me this year to cover, both days. So definitely there's more room for people to sign up. Okay. With that, I will just say thank you to all, everybody who was able to attend this training. We know it's, Monday evenings. We greatly appreciate you spending your time with us. And I want to give the flowers and much thanks to Sydney for this presentation as well. Greatly appreciate you. If you haven't figured it out, you can't get rid of the MRC. Okay. She left us some months ago. and she's still here and involved. So you can't get rid of us. We'll still be around, and we greatly appreciate you for your service. You might see Sydney in another, special event sometime in the future, maybe the broadsheet run or something else that we've mentioned. But with that, I will go ahead and just close it out. I'll hang on if anybody has any questions. Feel free to enter them in the chat or unmute yourselves. But yeah, I'll hang on for questions. If not, you can email me. I'll be in contact with you all. This training will be posted to YouTube, our YouTube page tomorrow. So you can check it out on there. Feel free to share the link with those who may be interested in learning more about this. For those of you who are selected for this deployment, I'll send you the recording as well. And thank you. Thank you so much, and enjoy the rest of your evening. Bye, everyone. Okay.
Mhm. I don't know if there's any more questions.
Yeah, I think that's it. All right. Yep, it seems like people are dropping off, so I'm just gonna wait until there's no one left, and I'll go ahead and close it out. If anybody has any one-on-one questions or anything specifically you wanted to speak to me about, you can either let me know in the chat so I know to hang on, or like I said, you can email me, text me, and I will make sure I respond and get you those answers.
Mm.
All right, there's 4 people
That's
left.
fine.
Have a good night, Cindy. Thank you.
Thank you.
I'm gonna allow you guys to unmute yourself and talk if you need to. If not, feel free to just go ahead and sign out. Okay. Option on the screen.